Council. Delighted to have you here for our program with Steve Morrison, Senior Vice President for Health Programs at CSIS. This is the third conversation we've had with Steve. He was our very first guest on March 26th. We spoke with him again on June 2nd. And we passed 1 million deaths worldwide yesterday. So this keeps going. Today's program is brought to you by the UPS Foundation and by you, the members of the World Affairs Council. If you're not a member, please become one. And I got a problem here. My battery's getting low and I need to plug in. Hang on a second. Don't want to lose that. And Steve, I got to run downstairs and get my charger. I'm going to apologize. Why don't you talk to everybody for a second? I'll be back.
All right. Hello, everyone. Thank you for joining. Good afternoon or good evening or good morning, wherever you happen to be. I'll offer a few opening thoughts sort of around where we are. We are, of course, approaching a moment fairly soon when we'll begin to see some of the results of the human trials on vaccines. And I wanted to just say a few words about sort of that situation, and I know Charles wanted to talk a bit about it. First, in terms of the background on where we are today, Charles referenced that over 1 million cases globally. United States, around 206,000 dead as of today, 7.1 million cases, maybe a little higher than that. We're still running at a pretty high rate. We're still running at 35 to 40,000 cases per day and 700 to 800 deaths per day. The hope had been that that baseline would be pushed down over the course of the summer to say 10,000. I mean, when you listened to Dr. Fauci or others, the idea was, okay, the peak had been achieved somewhere in April at a peak of 2,000, 2,200 deaths. It had come down, and the case count was coming down, but that didn't happen. We reopened too early. We had a rapid resurgence. In July, we got up to 1.75 thousand cases per day. We were cruising along at 60,000. And at that point, the hope was that a kind of renewed focus on masking, on social distancing, and on general vigilance would be possible to bring the case count, the baseline, down to about 10,000. And that would be a point at which we could begin to really reopen. But that's not happened. We're at this 35 to 40,000, 700 to 800 deaths. Interestingly, with the reopening of colleges and universities in August and up to now, we've seen that sector become a very important contributor, and those are young people. And they're contributing to estimated 3,200 cases per day. And going back to the very beginning, the universities and colleges are thought to have contributed about 88,000 cases as of mid-September. So when you think about what are the super spreaders, what are the places, the sectors of meat packing plants, unhygienic clinics, places where people congregate where they're going to have high transmission, those are coming to be that. Now, we also have a prediction today from one modeler, Chris Murray at the Institute for Health Metrics and Evaluation at the University of Washington. You've probably seen those models throughout the course of the year. Some of his earlier forecasts were adopted by the White House Task Force in trying to explain what would happen in the lockdown and beyond the lockdown, and they were fairly optimistic models. He's come out with models for the US and other parts of the world in which he's predicting that
and I'm back. Sorry,
that there will be a surge, a major surge in the United States. I'm just giving some preliminary remarks here. That we're heading into a period in November, December, January in which we're going to really get rocked badly. That the daily death count will rise to 3,000 by the end of the year. That the baseline of 35 to 40,000 will rise, and we will hit somewhere around 370,000 deaths as of January 1st. And this will carry forward into the new year. So we're the main line conclusion from all of this is that our health crisis continues unabated amid a lot of uncertainty. Now you're hearing voices coming from some other places that are saying we are already achieving herd immunity around this country, and that this is going to tailor off. The infections we're just around the corner, which is a term the president has used. There are folks who are making this argument, including Roger Atlas, a nuclear radiologist from Stanford, who's now in the White House advising the president, and being directly contradicted by Tony Fauci and Robert Redfield and others in those views that somehow the Americans have acquired herd immunity. The data that's come in the last week or 2 weeks on antibody presence in the American population, how many people have been infected and now live with antibodies, which may provide some measure of protection. We do not know how much and for how long, but the presumption is some measure of protection. What proportion of Americans today, after this first wave, have some level of immunities that may provide some measure of protection? That data is showing it's not all consensus. It's somewhere, but most are around the 9–10%. Some go as high as 16%. But what that tells you is that at this moment in time, 85 to 90% of Americans are naive to this virus. They are vulnerable. We are nowhere near herd immunity through infection, which is the view that some folks on the margins, including Senator Ron Paul, has suggested this guy Roger Atlas, but then there are others in the dark web that are pushing these ideas around that we've already attained herd immunity here in the United States, and we just need to stop worrying about masks and worrying about social distancing and worrying about people going to school and that sort of thing. 85 to 90% have no antibodies. In order to get to herd immunity for the United States, either through a vaccine or through people getting sick, we don't know what the actual level is, but it's generally thought to be 60 to 70% of Americans. So we have a long, long way before we get to that point. Now, we know that we've gone through a lot of crises here in the United States: economic dislocation, severe economic dislocation, furloughs, layoffs, unemployment, poverty, food insecurity. We are seeing an intensified housing crisis in major metropolitan areas. Tied to poverty, we're seeing the disruption of schooling, very turbulent, very chaotic period, very unsettling, very disturbing for everybody, parents and children. We're witnessing, obviously a sort of deepening political polarization, community instability, racially based strife, social and racial disparities magnified. And that brings me back to vaccines. Right now, there are in the world 10 vaccines that are in what are called phase 3 clinical trials. That is, these are 10 promising candidate vaccines. Not all the same. There are different types of vaccines with different requirements. 4 of them are in the United States. They're funded by Operation Warp Speed, the United States. There are 4 in China, and there's 2 others. And they're moving along at a rapid, very, very rapid pace, much faster than before. And we will begin to see some of the early results of those phase 3 trials in the coming weeks or months. Pfizer, we may see something soon. The others are saying probably, the US one's probably into the new year. And if the data is promising, it may permit them to request from the Food and Drug Administration permission to begin doing what's called emergency use authorization. That is, they haven't completed the full trial, but the results are promising enough that in the midst of an emergency, they'll be given permission to put those vaccines forward to perhaps just limited subpopulations. I'm going to go back to the boss here. Charles,
Okay.
you're back.
Yeah. Let me follow up on that. I mean, the issue is trust, right? That you've got to trust that you want to get the vaccine. And it's not just anti-vaxxers who are having concerns about getting a vaccine. It's gaining in the population generally, regardless of party, political affiliation. How does one know? First of all, if I'm a pharmaceutical company, I've got to be very concerned that I'm going to suffer reputational risk. I mean, how do we know that when a vaccine comes out that it's going to be safe and effective?
Well, that's a great question, and it's a central question, because if we are entering a moment in time soon, how soon? Maybe it's a month from now. There's a lot of controversy around whether President Trump is going to manipulate things. There's a lot of back and forth on that. But let's just assume that sometime in the near to medium term, we get results from some of these trials, and they look like they have the scientific data to back up the idea that this is safe and effective, and we can begin to use it. Then the question is, okay, if you want to get to 70% of coverage of Americans, and it's a two doses, so it's going to take quite a while to get 70% of Americans through 2 doses effectively. And what if half of our population says, I'm not doing that, I'm waiting? And that's what the Kaiser Family Foundation survey from September 8th to 13th said. 49% of Americans said, we ain't taking that vaccine when it's put on offer. Only 21% of that population that was surveyed across America said that they would be delighted to take on that vaccine. So there's been a precipitous decline. That 21% is half of what it was 3 months ago. Right. That 49% that said hell no is twice of what it was. And then there are all these other places. Up to 70% are saying they don't believe anything the president says with respect to vaccines. So if you step back for a moment, and I mean this in a nonpartisan way, I'm just looking at surveys. We have seen a precipitous decline in America's trust in science, in public health, in the president, and in vaccines. And why has that happened? The principal reason is, first of all, there was a pre-existing skepticism fed from multiple directions. You've had an anti-vaccine movement. You've had concerned parents groups that have become mobilized and ask very good questions around. Most vaccines are given to children in the early years of their lives, so parents groups are very important. And they formed a movement of being populist scientists asking aggressive questions. You then have also a very active anti-vaccine movement. So you've got that out there. Then you have, and you've got populism as an ideology which questions science and authority. Then you have those who don't like Trump, who are saying, well, I don't expect, I'm not going to trust one. So you've got multiple directions that are feeding all of this. But at the center of all of it is the Trump administration has engaged in contradictory and erratic communications. It has deliberate, repeated falsehoods as to what the situation is with regard to this pandemic. And there's been sustained interference and very overt sustained interference and assaults upon the Food and Drug Administration and the Centers for Disease Control and Prevention there in Atlanta. Right. So, and this has had an accumulative effect of driving these numbers way down to a point that I'm arguing is a crisis point. By that, I mean, our national security rests on us getting out from under this virus. Our economy, our schools, our churches, all of the lives and functions of our society require that we find a way to get, it's not just vaccines. It's vaccines, it's better therapies, it's better testing, it's continued vigilance, it's continued mask use in the situations that are dense, it's continued hand washing and common sense behavioral change and the like. That'll get us back out from underneath this. But if we're blocked from those vaccines getting into people's arms on sufficient numbers in a timely basis, by the fact that the public itself is refusing, that's a national security problem in my mind. You agree, Charles?
Absolutely.
So what are we going to do? What are we going to do about it? You know, what are we going to do about it? It's an urgent problem. The Trump administration is about to unveil a public communications campaign, which I think is, we haven't seen it yet, but I think it's about $250 million of media buys. That's not an elaborate national campaign in a media market where a presidential campaign spends 4 times that much on media buys over the course of the campaign cycle. But nonetheless, there's going to be media buys, and it's trying to address, reportedly from what's been said by folks in the White House and the task force, it's addressing questions of despair and trying to restore hope in people.
I thought a bunch of pharmaceutical companies came together and said that, they had set up their own, these are the standards we're going to meet. We're not going to proceed with general inoculations using our vaccines. And I mean, does that help regain trust in these vaccines?
Well, that's a very good question, good point. Several different key individuals and several key institutions, including industry and including people in FDA and at CDC, have stepped forward to try to bolster Americans' trust and confidence in the process by which the vaccines are being developed, and in hopes that people begin to feel like this is a process with integrity and we can trust it and it's not going to be manipulated. The fears are being intensified because we're approaching November 3rd, right? When we get on the other side of November 3rd, the psychology is going to differ a bit. Right now, the president's saying, we're going to have this ready to go. We're going to have 100 million or 300 million vaccines. We're going to begin, and then having people in the industry and people in the government saying, no, that's not true. I mean, you had the president reprimanding and contradicting Robert Redfield last week on that very issue. When are vaccines going to be available on a large scale for Americans? He said, Robert Redfield said 3rd or 4th quarter. President said, no, you're wrong. You're confused. It's going to be now. It's going to be it's going to be now and into the early part of next year. I promised Americans. Redfield's like, I'm reading the results here. I'm looking at the field charts. I'm looking at the plans. So Moncef Slaoui, who is a premier vaccine developer with a distinguished career at GSK, he was enlisted by the president to be the chief medical scientist at Operation Warp Speed, which is the U.S. effort that's financing the 6 major vaccine trials, and it's put $11 billion into that. So Moncef Slaoui, he's a very respected person. He's taken this on, and he said recently, publicly, that this is a quote: he won't be swayed by political pressures to rush an unsafe or an ineffective vaccine. Science will carry the day. I would immediately resign if there is undue interference in this process. That's a pretty stark statement from the guy who's the chief medical officer, Operation Warp Speed. You had Stephen Hahn, head of FDA, come forward and talk about how they're going to stand their ground. And then you had the person that Peter Marks, who has to sign off on the approval of experimental vaccines. He's the key person to make that determination, and he's publicly come out and said, if I make a recommendation and it's overridden for political purposes, I'm resigning. Next week, a letter came forward from 7 of his colleagues. We're resigning. 9 of the major drug makers came forward and said that they would, who had received the Operation Warp Speed funding, they issued a safety pledge to assure the public they will not submit vaccine candidates for FDA review until their safety and efficacy is shown in large clinical trials. All of these things are unprecedented. There's one other thing I want to mention, which is 3 of the firms, AstraZeneca, Pfizer, and Moderna, each released the blueprints, the details of how they are actually conducting their vaccine trials. These are like a 150-page document with all the inside details on how they do these trials. Now, that's very proprietary information. These are firms that are competing against one another, but it's very scientific and it's very detailed, and they wanted the public to see the level of rigor and discipline that's being brought to the task so that they can be judged by that themselves. So that they are trying to say to the American public, we know that your trust in us, the drug industry, extends not just to this vaccine, it extends to all the other products that you buy from us. And if we screw this up, it will ruin our reputation for a generation. And we don't want that. So those are some of the things that are coming about as pushbacks, but it ain't enough. It ain't enough. It is not going to be enough, I don't think, to reverse what we've seen, this precipitous decline in American trust and confidence in science, public health, vaccines, and the White House.
But if the number of cases is going to increase precipitously in the winter, when you said January, February, we're really in for a tough
November,
time,
December,
right?
January are going to be rough.
Yeah, I think, yeah, you said what, 3 times the number of cases?
Right. Doubling of deaths by the end of the year, and a tripling, of the aggregate.
Yeah.
And then a tripling of the daily rate. Yeah.
Yeah. Well, that's going to work on the other side. If ordinary citizens see things getting worse, then that vaccine is going to appear to be more attractive.
Yes. Yes. And we will, yes, people will be feeling more pressure. This is not just a simple measure of, well, do you want to get a seasonal flu vaccine this year or not? And well, I don't like vaccines and it's not that effective. And I never get the flu. This is something that can kill you or someone else if you infect someone else. And it's destroying, it's totally disrupting all aspects of our lives. So yes, and if the threat is magnified. But I want to make a couple of other comparative points here. President Putin on August 11th made a very surprising announcement. He said, we have a great vaccine. We're going to call it Sputnik 5. It's a great vaccine. We know it's a great vaccine. We've put it through phase 1 and phase 2 trials with at least 76 people. And we know it's safe and effective. So guess what? We're going to start sharing it. We're going to get teachers to do it, healthcare workers. We're going to share it with some of our friends outside. And Phil Duterte's excited about it in the Philippines and various other people. We're going to market this thing. And then they had this very elaborate website where, we're back. We're the champions of the world. We're doing this, blah, blah, blah. And the rest of the scientific world is saying, whoa, wait a second. With no phase 3 field trials, you have no idea if this vaccine is going to disable or cripple people. And what's the deal? How do you imagine that WHO is going to bless this or anybody else is going to want to take this? So they continue to say, oh, we're moving ahead. We're going into production. And they start trash talking all the other American vaccines or the Chinese. They don't trash talk the Chinese, but they trash talk the European and the American vaccines. But 60% of Russians are refusing to take the vaccine.
Wow.
60%. Now the Chinese, around the same time, came out and said, well, we have these 4 in human trials. 2 of them look pretty good. We've been through phase 1 and phase 2. And we're going to move ahead and start mass immunizing our own populations. We don't need phase 3. We'll get to that later. And again, people are like, that's cutting corners.
If you can't do it in an authoritarian society, it's going to even be much harder in an open and democratic society.
Correct. And so this is not a problem only for Americans. This is a problem of populations that are skeptical of their governments, who've had bad experiences with their governments on medicines. There have been scandals upon scandals in China of bad vaccines being administered to people. And so we're not alone in this problem of the sense of urgency to get out from underneath this, but also a sense of caution and fear and a global movement that's very suspicious of science and of vaccines.
Yeah. Let me, to the audience, please send your questions using the Q&A function at the toolbar on the bottom of the Zoom screen. And we'll get to them in a minute. I've got a last question for Steve before we go to questions from the audience. and that is nursing homes, senior citizen facilities.
Yeah.
And there was a disproportionate number of the fatalities.
Yes.
Certainly in April and May and June were in nursing homes, not just in the US, but around the world. Have we put protocols in place? Has the CDC issued guidelines? What are we doing so there's no repeat of that in November, December, January, when we have both the resurgence of COVID and flu upon us at the same time?
Right, we're going to have flu coming in, which is another compound factor. I mean, the reason that the argument around the surge in the winter is that you're going to have it get cold, and the virus will perform even faster in the cold. People will be going indoors. There will be the confluence with flu, and that we're seeing a constant across this country, a constant deterioration in masking and in social distancing and in overall vigilance. And those things in combination are going to lead to that. On the nursing home issue, we have had some horrible lessons from this episode, this first phase, in terms of inadequate hygiene, inadequate use of PPE, protective gear and training of staff, lots of transmission. I mean, nursing homes are typically have not terribly well-educated service industry folks who are coming in, and they may not be well protected or well trained, and they can transmit the virus into that setting. The hygiene and infection controls are oftentimes not very effective. And so there was very high incidence and very high mortality rates in nursing homes. And there are some lawsuits that are underway, and there's some investigations, and there's debate in Congress around should the oversight and accountability and regulatory environment for them be changed. And I think it's early days. I don't think we're seeing, there's been some changes, but we're not seeing all that much. Just as an aside, the Swedish government chose to pursue, Sweden's a country of 10 million people. It chose to pursue a policy much different than our own, in which they didn't do a total lockdown. They did partial closures. They didn't close their elementary schools. They took a different attitude of trusting people trusting their government, people agreeing to voluntarily live by these measures of mask, and not masks so much as social distancing, stay at home, work at home, like. And where they really got hit was the death rates in their elderly homes just went through the roof. And it's been a huge scandal and a very painful one for them, because they didn't protect those populations, which gets to the point that as we move into this next phase, where we're going to have continued high rates of infection, lots of virus community transmission throughout America, while trying to bring in a vaccine, the elderly population are going to need to be the focus both of ensuring protection is enhanced so they don't get sick, and then ensuring that they get the vaccines in the earliest possible moment. Those two things are going to come together.
Okay, here's some questions from the audience. Ray Erras, and I apologize if I'm mispronouncing your name. For everyone, is about U.S. withdrawal from the WHO. How does that help or hinder coordination with our international partners, particularly when it's time to distribute vaccines?
It's a great question. President Trump on April 14th announced that he was suspending funding to the World Health Organization, accusing it of being an accomplice of the Chinese, of having been captured by the Chinese, and the Chinese covering up and deflecting and obscuring what happened in the early phase of the virus being discovered in China. And then in June, the president followed up and announced the termination. He was terminating U.S. membership in WHO. It takes a year to complete that. and was diverting funds to other things. And this was very unsettling. And it was coming in the midst of this pandemic. And it's something that certainly I and many other people opposed by saying, look, WHO is a member state organization. It does not have inspection power to go into countries and inspect. It does not have its own intelligence community. It's reliant as a member state organization. It has to be highly deferential to the member states, and it's reliant on permission to get in and out, and it's reliant on them to voluntarily share whatever they do. So it's always in a very vulnerable position. And that's the reality, and that could be strengthened. Now, the United States, by decoupling in that fashion, also has chosen not to be part of the effort at figuring out how to get vaccines into low-income and middle-income countries. Let me back up for a moment. As I said, there's 10 vaccines that are in phase 3 trials. There's a total of 30 that are in human trials. So, that other 20 will move into phase 3 trials, most of them. And then there's another 130 vaccines that are in preclinical looks. So there's going to be a lot of activity that moves stuff forward. But in that first raft, what have we seen happen? What we've seen happen is that the wealthy countries, the wealthy and most powerful countries of the world, have locked up supplies for their own populations. They've pre-purchased. That's true for the most powerful governments, and it's true for the most powerful industry elements. And so they've locked up about 4 billion doses. In other words, let's say I am Pfizer, and Operation Warp Speed has said, okay, here's $1 billion. Get that through field trials. But in the same time, what we want you to do is build the factory and produce the vaccine right now. We'll pay you for it. And if it turns out that vaccine is really safe and effective, then you're ready to roll right away. If it turns out it's not a very good vaccine, it goes in the junk heap. And we're doing that with all of them. And so the wealthier countries and some of the big firms like AstraZeneca, they've locked up their supplies, and it's raised this question: what about low income and lower middle income countries that don't have the same deep pockets? I can't go out and bid on those things. How are we going to get them? Because just giving out vaccines to the wealthy populations doesn't fix the problem. This is a global problem. And if we could have a continued outbreak just outside our borders, and we imagine that air traffic and trade and everything else is going to resume, well, guess what? You may vaccinate everybody in the United States twice, but if you're continuing to have a global economy and a global mixing, people are going to be coming back and forth to school and doing business. Well, we have to have a global solution. And so the European Union, the Brits, the French, Gates Foundation Wellcome Trust, and WHO came together in April, formed something called the ACT Accelerator. Within that is a vaccine facility, the COVAX vaccine facility, in which they are raising money and trying to get countries to donate to Gavi, the Vaccine Alliance, but also get governments to make their own commercial investments in the vaccines there, as a way of building confidence that the rest of the world's not going to be left in the cold. This week is the week of UN General Assembly. Boris Johnson gave a speech, I think it's today, big speech, announced big donation, $500 million to the vaccine facility. Great donation, great step. The EU is likely to make a commitment, but it's a struggle. It's a struggle to get funding.
But U.S., China, and Russia are all staying outside.
China, and Russia are on the margins, and the U.S. has said, U.S. debated this. They had an internal debate, a serious internal debate. Should we be part of COVAX facility or not? I mean, it doesn't make sense. We should be part of this. And you had people like Secretary Pompeo and Secretary Azar making that case, but they lost. And they lost because the China hawks and the WHO hardliners said, no. WHO is part of that COVAX thing. And we just said we weren't going to have anything to do with WHO. So we're not going to have anything to do with supporting Gavi to get the vaccines it needs. So you see the kind of somewhat idiotic predicaments we now find ourselves in, where For a few $1 billion, we buy credibility, influence, and enormously important things happening outside the world. But because we've taken a stand that says WHO is the enemy and we're not going to touch them, and yet WHO is a partner across a whole spectrum of things. You know, every year when the determination is made, what's going to be in the flu vaccine, the seasonal flu vaccine that comes out in August. They have to make a determination 6-8 months earlier on what 3 flu variants are going to be contained in that thing. Well, who does that determination? Well, it's a team of US scientists with a team of WHO scientists. Is that going to stop? Maybe. And the Global Polio Eradication Initiative, on the cusp of final success if we can crack the code in Afghanistan and Pakistan. US has been a partner in that for 30 years. It's no longer a partner because WHO is part of it. We have all of these quandaries that are going to have to be sorted out. And it's not pretty. One last point on WHO. The World Health Assembly in May passed a measure that said, let's have an independent panel created to look at the response up to now. Even in the middle of the pandemic, let's get an independent panel together to tell us how we've done good, bad, and ugly, and what things need to be changed. That panel began its work. It was appointed and began its work 10 days ago. And it is chaired by 2 former heads of state. Helen Clark, former Prime Minister of New Zealand, and Ellen Johnson Sirleaf, former President of Liberia. And it includes in its secretariat Anders Nordstrom, the former acting Director General of WHO. And it's got a number of other people. And it will be independent, and it will look at, okay, what kind of steps are needed to strengthen WHO so that it doesn't get caught in some escalating confrontation between the United States and China, which is what has happened here around COVID.
Okay, we've got several questions asking if Joe Biden would handle this better than Donald Trump. And my answer, we're not going to answer that except watch the debate tonight, because that's going to be one of the topics of discussion. And I think you should make your own decision with regard to that, everybody. I appreciate it. The last question about World Health Organization was from Georgie Fu. Thank you, Georgie. There are a number of questions from individuals about what can we do? What can we as individuals do? I mean, the parents, school teachers, ordinary citizens, what can we do to confront this virus and this epidemic?
That's a great question. On the Biden piece, there's plenty laid out in the Biden campaign position papers and in the platform that was approved at the Democratic National Convention meeting that lays out in quite a bit of detail what Biden would do. And I could give you a recap of that, but Charles was right. Just go read that and then go look for the Republican platform. There is not one. There is zero. There's not a single word amounting to a platform coming out of the Republican National Convention. So you tell me what they're going to do in the second 4 years on this particular crisis. So as far as what can citizens do? Well, the first and foremost thing is vote. I don't care who you vote for. I do a little bit, but
yes, you do.
That's not my point. That's not my purpose here. But as Americans, vote. And don't let anybody dissuade you that you shouldn't be voting because it looks like it's a fake vote or something. I think on the vaccine hesitancy and trust issue, Americans from different walks of life need to have greater voice in wanting to get out from underneath this virus and this pandemic. And they want to be listened to, and they want to have an informed discussion around the merits and the risks of vaccines. And so parents groups, farmers groups, farm labor groups, educators, people work in social media. If you think about it, there's groups that are going to really lose badly if we can't get this vaccine in place quickly. And they're going to lose the most, and they have the most to gain by this. So more voice to key social and economic sectors that should be speaking up and saying, you know, let's not listen to fake science. Let's have a sensible dialogue about what, and if you have concerns, voice them and force public health authorities to listen to you about those things. In terms of what you ask of your elected officials, I mean, is it in our best interest? Isn't it in our best interest to demand of our officials that we have adequate testing in our communities that is safe, reliable, and fast and affordable? So that that with the testing, shouldn't we have in all of our communities the capacity to isolate, marginalize, and contact trace? So that once we get some control over this pandemic and we introduce vaccines, we're still going to have outbreaks. But right now, we have 3,000 public health jurisdictions in America of various sizes and types, and only a very small minority of them have adequate testing and have adequate ability to isolate, quarantine those who are sick, make sure they're taken care of, and do the contact tracing to identify the people that may be also going on to infect others. So it just seems to me to make sense to demand that of your elected officials. Similarly, why not demand that some of the things that we need be available to us reliably and affordably, like masks and sanitizers, and that government make a pledge to us that there's not going to be acute shortages because nobody cares. I mean, putting responsibility for markets, for PPEs, protective gear, and basic commodities, it's a ridiculous notion in the midst of an emergency, because you wind up with acute shortages, price gouging, and crappy stuff on the market. And that's what we're living with. We've been living with that for 8 or 9 months. We should demand that stop, regardless of who gets elected. I have a few other ideas, but I'll stop there.
Okay, and I got a bunch of questions. Some of them are quite complicated. We're going to go a little bit long if that's okay with
you. That's fine.
Because I screwed up at the beginning. And so this is the time to come in with short answers, Steve.
Sure.
If you're capable of doing that. Okay, this is from Samar Misra, who asks, I'm going to summarize this, given mistrust in vaccines, and that even a vaccine that's approved will only be, 50-60% effective?
We don't know yet.
But that's the target, correct? To be 60% effective?
Any vaccine that has to be at least 50% effective to apply for emergency use authorization.
Okay.
But what we would hope would be 80 or 90% effective.
Yeah. But as you said, our flu vaccines are only
40 to 60%.
Yeah. So, okay. Wouldn't alternatives to vaccine, plasma therapy, taking proper nutrients, masking, distancing, hand hygiene, wouldn't that help all these things short of the vaccine or in addition to the vaccine?
That's a great question. And I do think that we will see some gains in therapies that will reduce severe illness. The most promising therapies that are in development today are monoclonal antibodies. Monoclonal antibodies are showing a lot of promise. Well, they're not on the market yet. They're not fully through, the emergency authorization experimentation. But there's a lot of excitement in the world of therapies around these, which would take somebody who gets sick, stall that person from moving to severe illness. That's a very, very important intervention. Right now, we have remdesivir and we have the steroids.
Yes.
And both of those are for use for people who are in extreme condition and trying to avoid death. And those are valuable, but they don't apply, they don't prevent, and they can't reduce mild illness from progressing to severe illness, which is what the monoclonal antibodies hope. So your questioner's point is a very good one, which is we need a package of steps to improve the health and protect the population. And it's going to be a mixture for a long time. It's not there's no magic bullet, and vaccines are not going to be a magic bullet. And we're going to wind up probably doing a variety of different vaccines, and there's going to be first, second, third generation vaccines that come.
Sure.
So the picture's going to evolve.
That makes sense. Okay, this is from Melissa Frey, who is my favorite teacher at Decatur High School. And she says that they're supposed to be moving back to in-class instruction on November 2nd. That'll be choice by students, not by the teachers, however. In a high school environment, this places the average exposure of students and teachers over 100 individuals a week. What are your thoughts about reopening schools?
Well, I'm less familiar with high schools. I've been looking at universities. We did a podcast this morning on reopening of universities. I'm going to do another one in another 2 weeks, 3 weeks, with the chancellor of one of the major universities. There's a couple of things that apply to high schools, I think. One is you got to get the testing right. Mm-hmm. We've seen a lot of innovation in testing at the college and university level. Lots of innovation. The Broad Institute in Boston has 116 different institutions that it serves. Illinois at Urbana-Champaign, a wonderful job. Arizona, there's places that are innovating, using different technologies, making sure that so that's very important. Leadership is terribly important. Leadership that makes sure that students understand that the reopening is in order to benefit them, but that there's a need to protect the common community. There has to be discipline, and there has to be a commitment to this, and there has to be compassion and listening to this. It's hard with younger students. It's hard with 18 to 22-year-olds, as we've seen. I mean, you look at what happened in UC Chapel Hill, UNC, University of North Carolina, Chapel Hill. Look what happened at University of Wisconsin. Here you had massive explosions of outbreaks, concentrated in the fraternities, sororities, some of the freshman dorms, some of the bars, and it just shocked people. And you can't afford to have things fall apart. You have to be prepared for some setbacks and have a plan for that. And you have to get everybody bought in, it seems to me, to what the rules of the road are, and that it's for purposes that in-person learning is a very, very important dimension. It's not the only important one. I mean, I believe that hybrid models in many places are working quite well, that a lot of the online stuff has turned out to be quite innovative and useful. But there's no substitution for this. And I know you have to protect your teachers against this transmission, and you have to make sure that they're comfortable and bought in on this as well.
Okay, my friend Michael Mudler asks, which of the 6 vaccines in phase 3 trials do you think have a higher efficacy? Is it too early to judge? Do you have a view on that? Bill Gates says there's one that is outstanding, but did not name it, says Michael.
There's a lot of excitement around what are called the messenger RNA vaccines, which are new and experimental. Moderna and Pfizer both fit into that category. Those are the ones that have to be kept at very low temperatures in freezers. They're very fragile genetic material, but they're showing very promising results. We'll see. There's the Astrazeneca vaccine, which is what's called an adenovirus virus, which they're using a common cold virus, and they're putting the genetic material into that and putting that into people. That's very innovative. That's gotten a lot of excitement as well. And but they had to interrupt their field trials because they had an adverse incident in Britain, I believe, or maybe it was in South Africa. They're doing field trials in the U.S., Britain, and South Africa, and it was transverse myelitis. It was an inflammation, very dangerous inflammation in the spine. They have not resumed the field trials in the United States yet. Interestingly. I think, we have a diverse portfolio of vaccines in those first 10 and in the first 30 that are in human trials. That's a very, very promising thing. That's a very good thing. That's, I think, what gives people a lot of hope that these are quality. If you reached phase 3, if you get through the first phases of the basic safety and efficacy, and you get into phase 3, your odds of success rise to over 30%. That's pretty good. That's pretty good when you're talking about vaccines. People, though, are a little worried because it's moving so fast. In other words, people want it to move fast. The science is allowing us to move fast. Governments are putting the money in to make it move fast, get all the production lined up and everything else. But it also makes people a little nervous, and that's feeding some of the anxiety and hesitation about the vaccines.
Cedric Sersman asks.
Cedric. Hi, Cedric.
He says, Steve, are you going to get vaccinated as soon as it is available?
Well, Cedric, that's a great question. And I think the answer is only after I have seen what the science is behind the request for emergency use authorization. In other words, if I think I and 70% of Americans, if we're told on November 1st that guess what, a miracle has happened and we have something for you here 2 days, 3 days before the elections on emergency use authorization, I will be very cautious about that and want to see the science. I think we need to take our cues from those who really know what's going on and know virology and regulatory processes, and who are going to be honest and informed about this. And I'm encouraged that so many of those people that I talked about earlier are being very vocal, and they're not going to stop being very vocal. So what, I would be looking at, well, what do they say? What do they say? If they go silent, I would be worried.
Okay, man, we've got a ton of questions, and we're getting close to the end of the hour. And this one about contact tracing from Georgie Foods. As many people are on the fence because they think it's going to infringe their freedom. Mm-hmm. How do you balance freedom versus the common good?
Well, contact tracing, we've used this for 100 years as a method, 70, 80 years for all sorts of, for sexually transmitted diseases, for all sorts of things that are infectious, where you need to figure out, you need to try and stop the chain of transmission through this. So we've learned a lot about that, about what it takes to have effective contact tracing, and a couple of the things that have been learned. And we published a short piece on this, actually, that's on the CSIS site. First of all, you have to be extremely respectful of people, and you can't order them around. You have to make them understand that it's in their best interest. If they've been exposed, they should be concerned about themselves, and they should be concerned about their family and others that they may expose. So you need to be respectful and engaged, and people need to understand it's in their best interest. You need to try and preserve anonymity because there's stigma in this at play, and people don't want that. And sometimes behavior is tied to other things, right? The exposure happens under a set of circumstances that people really don't want others to know about that. If you're engaging in some activity in some place that you don't want others to know that, and that's where you were exposed. So you can imagine all the sensitivities that come around this. It's tough. Contact tracing is difficult to do effectively, and you really have to stick with it, and you have to work through community leaders You have to get the doors open to individuals through people who are respected leaders, who validate for you. If you just show up as an external person, particularly if you're coming from outside of a community that's really impacted, that's perhaps poorer, or a community that's Black or Latinx, which are getting hammered by this disease and feel like they have been left to be hammered. When contact tracers show up, there's oftentimes a lot of resentment. Why are we hearing from you now?
Where were you when we needed you?
Why didn't you care about us before we got hammered?
Okay, Otis Threat asked this question. As we move indoors for winter and we gather more indoors, whether it's with our family, our neighbors, yes, whatever. When we were chatting before, you talked about you've got you're thinking about doing in-person meetings again.
Yes.
How do you handle that? What do you do? I mean, do you maintain 6 feet while you're indoors? Do you have your meeting and everybody wears the mask in the meeting? Mm-hmm. What are your suggestions for dealing with indoors contacts?
I mean, I had the first meeting in 6 months at CSIS indoors on Friday. There were only 4 of us in a big room, and everybody had their mask on, and everybody was a very great distance from one another, and the air was very well ventilated, and surfaces were cleaned, and it didn't go on very long.
So why didn't you just do it by Zoom? I mean, why did you do an in-person meeting?
I wanted to. Well, first of all, it was a senior British diplomat, and who requested to come by, which was interesting. And I had said, I'll come to see you, or you can come see me, or we can do it by Zoom. You tell me what you want to do. I'm comfortable as long as protocols are followed, and I feel safe. That's fine. If you want to come to CSIS, I guarantee you I can make it as safe as possible. Never free of risk. It's the same reason why I think that schools should be doing hybrids. It's basically that there's a human element to the work we do. We need to regain something in the work that we do. We need to regain the ability to see each other and be each other's presence. And a lot of what happens that's creative and meaningful happens not through a planned intervention, but happens in a more informal fashion, in a more relaxed setting. Now, it's not very relaxed to sit around a room with people in masks, 3 or 4 people with masks on. But you got to kind of take it a step at a time. And it's just like it's not very relaxed to be trying to teach a class with a bunch of students with their masks on when they could be sitting at home in front of a laptop and not have to wear a mask. So I think that people gain a certain sense of agency in this period of uncertainty. That people gain a sense of confidence and control in their life and agency in their life when they do certain things. When you go get yourself tested, just because, for either the virus or the antibodies, it gives you a sense of agency. When you push the margins a little bit and say, virus in our communities come down to reproductive levels are below 1. In DC, the virus levels are under control for the time being. I don't feel, the levels have come down. Now they may go back up, but if they've come down, it's safer under controlled circumstances to do this sort of thing. And let's see, but it has to always be voluntary. It has to be people have to be comfortable, and people have very different risk tolerances, and you have to respect that. And so you can't force people or pressure people to do any of this. It has to be entirely whatever they think is comfortable.
Steve Morrison, I want to thank you so much for giving us an hour of your time today. This has been really useful, helpful. We've got questions we didn't get a chance to answer. I want to apologize to Jane Cronin and Priya Ratnakrishnan and Jorge Fernandez and Kim Nolte, whose questions I didn't get a chance to ask.
Well, you can answer them all later, Charles. I'm sure you know the answer.
I'm sure I don't. And a number of questions about younger people. Are we foolish to think that younger children are safe, that everything's okay?
Yeah.
Get back to that. Get back to that later. I want to urge everybody to watch the debate tonight. I want to urge everybody to please vote. I want to urge everybody to do something you didn't tell them to do, and that is please get your flu vaccine. They're in all the pharmacies now, and I've got mine, and I got the old guy version, which is stronger and
high dose.
Very glad to have it. On Thursday, we've got Paige Alexander at noon. She's the CEO of the Carter Center. And so we're going to talk about the Carter Center under her leadership, and with Jimmy Carter retired and home in Plains, what are her plans for the Carter Center? So please join us on Thursday. Steve Morrison, thank you again for joining us today. I hope you'll join us again in another couple of months and we can discuss this further. Every time we meet, there are new issues and things we hadn't talked about the previous time.
Well, it's great to be with you, and we've had this partnership with the council now for 9 years, and for us it's extremely valuable. And I haven't given my best to Fernanda as well, and so thank you so much for the opportunity. This is very valuable, and I really appreciate the chance. And yes, let's reconnect as we get into the new year and see where we are.
Good.
And say hello to Paige. She's an old friend of mine.
I will. She's terrific. And everybody should please join us on Thursday. I want to thank Fernanda Lucchini from the World Affairs Council staff. She's the Executive Director. And Valerin Lopez de Frank, who has taken over as producer of these programs. And so thank you very much, World Affairs Council staff. Thank you, CSIS and Steve Morrison for joining us again. And I want to thank all of you for spending an hour with us. And everybody have a good afternoon. Bye.
Bye-bye.